Godfrey's test. This is the Godfrey 90-90 or the SAG test. So we're going to hold them at 90 degrees of hip and knee flexion. Looking for PCL tear, you're looking for a drop of the tibial tuberosity. Valgus stress test. You want to do the valgus at two different angles. You want to do it first in full extension. You're going to test the medial joint capsule as well as the MCL. So just stabilize the distal end of the tibia and push medially. To isolate the MCL, we flexed the knee to 20 to 30 degrees and do it again. Looking for loss of an infield or increased laxity. Varus special test, same thing. We're going to do it at full extension to test the lateral joint, isolate the LCL with 20 to 30 degrees of flexion. Yes?
Can you do that when the patient's seated, or it has to be laying down?
They need to be laying down, so they're really relaxed. Quadriceps active test. We're here. You're going to look first for a sag on the tibial tuberosity, see if it's sitting further back, and then you'll have her contract her quads. So contract. When she contracts her quads, if she has a torn PCL, you'll see the tibia shift anteriorly. Okay? Slocum drawer test. So Slocum with internal rotation. You do it just like the anterior drawer, except the internally rotated foot stresses the anterior lateral joint complex. So anterior lateral rotatory instability with external rotation, anterior medial rotatory instability. Crossover test, stand up. This also tests for the rotatory instabilities. You'll just have her step all the way in front, farther, as far as you can. Okay, and then do it all the way back. Okay, so when you step in back, you're testing the anterior medial part of your knee. When you step in front, you're testing the anterior lateral. Pivot shift. Pivot shift is for ACL and it's anterior medial, but mainly the ACL. So you're going to do a valgus force on the knee and an externally rotated foot. You're going like this. Okay. You're looking for a fairly palpable clunk around 30 degrees, and that's when the tibia is subluxing on the femur. So fairly uncomfortable test. Roll over on your stomach. The dial test is for posterior lateral instability. You're just going to externally rotate both feet, see if they have the same amount of external rotation, and you'll do that at 90 degrees as well. So like at, I don't know, around 10 degrees and then around 90 degrees. Looking for increased external rotation, PCL, and posterior lateral. Roll over. External rotation recurvatum test. This is for posterior lateral rotatory instability. So you're going to just lift both legs, make sure they're fully relaxed. Thank you. And you're looking for the knee to fall into external rotation compared to the other one and recurvatum. So it'll hyperextend and the tibia will externally rotate if that part of the knee is damaged. Posterior lateral and medial drawer is just like the Slocum except in the posterior direction. So when you have the foot internally rotated, you are assessing the posterior lateral complex, so you're just going to push posteriorly. When you have it externally rotated, you're assessing the posterior medial joint. McMurray, that's your ribbon one. Fingers on the joint lines, testing for meniscus. Relax. Relax. Is your hip? No, your hip's super tight. There we go. All right, so you're going to do a valgus stress test and a varus on the way down, so you're just going to do that. Okay, and you're going to do it again with foot internally rotated. You're feeling for clicking on the joint line or pain. Realistically, most people with a meniscus tear won't let you do this. And then you're going to do it externally rotated and do it again. So you're stressing all the different parts of the meniscus.
You do that internally?
Yes. Internal, external, and neutral, technically. Roll over. Aplace compression distraction, also for meniscus. So you're going to compress and do internal, external rotation. Okay, that's going to hurt if you have a meniscus tear. And then you're going to repeat it with distraction. You can use a hand if you're working with a small leg. If you're working with a big leg, you just throw a knee up and grab it like this. Okay, so internal, external rotation, that won't hurt as much for meniscus. Stand up. Thessaly for meniscus. You want to support your patient, have them flex to about 5 degrees or 10 degrees, and then twist 3 times. Okay, then bend a little bit more to about 45 degrees. Okay, and twist some more. Okay, now looking for pain for meniscus. Wilson's test, sit down. Wilson's test is for osteochondral defects. You're gonna internally rotate your foot and slowly extend your knee. And if you have pain, you'll stop the motion and externally rotate the foot and keep extending, which should decrease the pain for an osteochondral defect. Noble's, go back. Lay down. Noble's test, you'll put your thumb on the lateral femoral condyle right there. So that's what I'm touching over here, and you're gonna relax. Just not get a regular relaxer. And then you're just gonna flex and extend the knee, putting a decent amount of pressure on that IT band. So it'll cause pain around 30 degrees when the IT band crosses over that lateral femoral condyle. For IT band friction syndrome. Sweep. For the sweep test, we're gonna sweep all the edema up into the suprapatellar pouch and hold it there, and you're gonna sweep down on the lateral side, and when you do that, you're looking for a little bulge of fluid to appear on the medial side, which will be positive for a joint effusion. Palatable patella, you're gonna sweep all this edema towards the midline, then like bob up and down on the patella. If it does go up and down, that's positive for diffusion. Patellar apprehension. You're gonna have the knee flexed about 20 degrees, relax. Then you'll be fully relaxed, and you are going to push, this awkward side, we're gonna do this side. We're gonna push the patella laterally and see if they get apprehensive or start to muscle guard, which would be positive for patellar instability. The medial synovial plica test. You're gonna find the medial plica. Then you're gonna push the patella medially, internally rotated foot, and just flex and extend. You're looking for pain over the plica and for it to like kind of rub under your finger. And then the last one is the stutter test. Sit up. Okay, you're gonna gently cup the patella while they extend the knee a couple of times. And you're just making sure that it runs smoothly under your hand. Any stuttering or irregularities would indicate a plica.